CDPHE Incident Commander Scott Bookman with us to give an update on sort of the progress and developments over the last 13 months. We have state epidemiologist Dr. Rachel Herlihy to discuss this fourth wave that Colorado and United States as a whole we currently find ourselves in. And we also have Chief Medical Officer of Colorado, Dr. Eric Frantz, who's going to talk about vaccination clinics and how safe and effective the vaccines are. First, I want to share the numbers with you. This is a time of great concern in Colorado. We are back over 400 hospitalizations. 404 of our fellow Coloradans are hospitalized with COVID right now. This is the first time since February 19th that we've been over 400. If you recall, we actually dipped below 300 not that long ago, so significant increase. That being said, we have plenty of capacity. We are not at hospital capacity, but this increase is a great alarm. The fact that it increased from just under 300 to just over 400 over a period of weeks really underscores the importance of being careful and finishing out this pandemic strong, which means over the next few weeks and months, especially if you haven't been vaccinated, please wear a mask whenever you're around others and avoid social gatherings. If you've been vaccinated, you have a lot more, you can be confident and do a lot more of your normal activities. But if you haven't been vaccinated and are vulnerable to this virus at any age, and what we've seen with the hospitalizations is now the biggest increase is 18 to 50-year-olds, and that's what Dr. Herlihy will talk about, because most of our older Coloradans are protected. It's been wonderful. There's hardly any hospitalized. It's gone way down. But people are filling up the hospitals in the 18 to 50 age group. And this is a race against the clock. With the variants that are out there, it's really important, now more than ever, wear a mask around others and avoid social gatherings. And guess what? It's spring. Outside is wonderful. The great outdoors were really our respite last spring, and early summer, where we beat down case numbers, and what a great way to recreate if you really want to see friends. A bike outing or a hiking outing, much better than much lower risk than visiting people in their home or indoors. And with beautiful spring weather, I really encourage everybody to get out and enjoy the great vast outdoors in Colorado. We also identified 1,935 new positive cases yesterday. That's also the highest it's been in a long time. 32,000 tests. We do want to encourage everybody who has symptoms to get tested, and until you get those test results back, isolate yourself if you have any symptoms. And I know it's been a long time. I just want to remind people that not everybody who is contagious has symptoms, and that's why we wear the mask. And why we avoid social gatherings, because it can be somebody who unknowingly gives it to you. And it can be a very severe symptoms, and you could be hospitalized and maybe not even make it, but the person who gave it to you might not even know that they have it or are giving it to you. So please, let's be careful. Our country is experiencing the fourth, and I don't think I'm too optimistic in saying this. I think it's the fourth and final wave. With everything we know about the vaccination schedule and what's happening, I don't expect there'll be a fifth wave, but that's not our concern right now. It's this fourth wave. And especially those who are unvaccinated, 18 to 50, let's be careful in the final few weeks. We're almost back to normal. It's only till mid to late May where everybody who wants a vaccine will be able to get it. Immunity in June, a normal summer. We don't want a setback now, so please, let's be careful. With that, I'll turn it over to Dr. Frantz.
Thank you, Governor. It's hard to believe that we're actually getting to a place now where we're getting almost 500,000 doses a week of vaccine, and we're administering those as soon as we can. It's also hard to think that it was only 48 hours ago that I got my first call as Chief Medical Officer about a series of events that were happening at one of our community vaccination sites. A number of people that were dizzy, pale, unwell, nauseated, and we very quickly reacted. And I think about this last 48 hours, and I'm very impressed that we have the kind of oversight of a health system that you'd want during this time of mass vaccination work. So think about it. We had the call just 3 o'clock on Wednesday with me, the Chief Medical Officer, the medical personnel at the site, and quickly made the decision it was important to shut down for the afternoon. We contacted and had conversations with the CDC staff that evening. We had the FDA review the lot numbers to assure that there were no other events similarly happening for these vaccines. And ultimately, we decided that this was no cause for concern. These were the kinds of reactions that people often have with medical procedures, whether it's a blood draw, whether it's having your blood pressure checked, vaccines. There are folks who will be nervous and will be worried, sometimes get dizzy and even faint. So we're currently working hard to be sure that we build the right processes in place to keep things safe for everybody using these sites. If you can do your part by making sure you've had something to drink before you arrive, bring a snack, bring a friend to reassure you, then we can best manage going forward. The vaccines are safe. These are expected dizziness that occur for some people with vaccinations, and we'll continue to work to make sure this is safe and works as best as possible. Thank you.
Thank you, Dr. France. And we know there's a lot of questions about the vaccines, and that's what's important to know is that what we saw at Dix is really statistically consistent with what you would see at any type of place which does blood draws or gives regular shots or tests blood pressure. There'll be people who go in that maybe they're a little dehydrated before they go in. Maybe they just are nervous around needles, and that's common. What we would look for is if it ever exceeds that normal band. If all of a sudden you see more people than expected that experience these types of symptoms, then you say something's going on here. And the conclusion initially, at least from Dick's Sporting Goods, is within the normal parameters of human behavior and how people feel. And we can expect at every large clinic, just as at every doctor's office, there's people that get a little queasy around needles and get a little nervous, and that's very normal. Today marks 13 months and 4 days since the first COVID case was confirmed in Colorado, March 5th, 2020. It's likely we had COVID in the state before that, but that was the first confirmed COVID case about 14 months ago. Even before the first COVID death was reported in Colorado, and by the way, I want to also acknowledge that we have now lost 6,926 people due to COVID in our state. So unfortunately, we are fast approaching the milestone of 7,000 lives lost. Without the mask wearing and the efforts to avoid socializing, it would be far higher, 2 to 3 times that amount. It has been 2 to 3 times that amount in other states in our country. We're very grateful. But at the same time, it's sad that we have close to 7,000 of our fellow Coloradans who are no longer with us. And that's because Coloradans have done their part and are doing their part, wearing masks, practicing social distancing. At the same time, there were heart-wrenching images of frontline heroes that flooding social media across the world. And at that time, with the shortage of PPE, many of our nurses and doctors were forced to wear makeshift PPE and use masks for longer than expected. And we didn't want that to be the story of healthcare workers in Colorado. And we acted quickly to build Colorado's emergency stockpile, centering our efforts around innovation and collaboration. Our innovation response team worked closely with CDPHE and emergency management to get the supplies that we needed to people. And that included surgical loop masks and N95 and KN95 masks and ventilators and PCR tests. We had at that time hundreds and even thousands of promising leads. And with an influx that large, it was really important to us to design a system for sorting and accountability. There were companies that wanted us to pay in advance, but without having any idea what masks or materials looked like or whether they were even functional or safe, we refused to pay until we could certify their legitimacy. And in doing that, we saved Coloradans millions of dollars that unfortunately some other states lost by paying up front for defective or fraudulent or even dangerous supplies. We made dramatic changes to our state labs' capabilities to fill the need for COVID-19 testing supplies, and once the products, we verified them once they passed our test. We knew they would provide the best protection for frontline healthcare workers. We coordinated with the medical community to meet their needs. I'd like to turn it over to Commander Scott Bookman to walk through the process of building our state warehouse inventory from scratch and where we are today in our PPE procurement and testing capacity, because it's a very different place than we were in that first or second wave. And as we experience this fourth wave, and as Colorado's minimized the loss of life by wearing masks and being careful, it's also important to acknowledge how much further we are in terms of having the supplies we need for what lies ahead. Scott Bookman.
Thank you, Governor. Thank you, everybody, for joining us today. As the Governor mentioned, I'm going to walk you through where we were 13 months ago regarding our stockpile and where we are today. It was in March of 2020 that we found out that we were on our own. We had expected that the national stockpile was full and would be able to meet our needs. It quickly became apparent that each state was going to be responsible for finding our own supplies to meet the needs of this pandemic. That included testing supplies for COVID-19, N95 masks, surgical masks, gowns, face shields, coveralls, and possibly even ventilators. The national stockpile only had enough equipment for several days, sometimes even only a day at a time. So under the governor's leadership and direction, we created the Innovation Response Team, a partnership between Governor's Office, CDPHE, and Department of Emergency Management, really pulling together all of the state's resources to get the supplies needed to respond to this pandemic. Next slide, please. So we took on a new role as the state, which is to become a large purchaser of medical equipment, which required us to vet leads. Early on in this pandemic, everybody knew somebody who knew where to get testing equipment or a ventilator. And so, over time, we needed to develop strategies to ensure that we were using the state's resources appropriately to get the equipment that we needed when we needed it. And so we set up a system through the CIAC to the Colorado Information Analysis Center. We completed assessments of 17 businesses or individuals related to COVID PPE, and even today in our vaccine efforts. Next slide, please. So because of this diligence, the state of Colorado was able to avoid the big problems that other states faced. We never paid ahead of time, and we always vetted these products. And that allowed us to protect our resources and protect those who we were getting these supplies for. Next slide. As we bought these supplies from new manufacturers, new suppliers, it was incredibly important to ensure that these masks were safe and effective, to get them to our healthcare workers, to get them for the staff in our long-term care facilities. And so we partnered with Colorado State University to ensure that the PPE and masks that we were purchasing were safe and effective and could meet the standards that had been set. And only once we had verified that did we actually pay for the equipment that we had received. Next slide, please. Now, the State Public Health Laboratory in March of 2020, prior to the COVID-19 pandemic, was really a center of scientific excellence. It was not designed to be a high throughput laboratory. The state lab focused on certification and testing. We did microbiology testing, food and drinking water, marijuana screening, our newborn screening program, and then laboratory certification. But it became apparent early on in the crisis that the state lab was going to have to change dramatically to respond to this crisis. Next slide. So at the state lab, they began to evaluate new types of tests, new types of equipment. They vetted swabs, reagents, antibody tests, PCRs, looking at different types of collection, figuring out whether ordinary Q-tips could be used to do specimen collection, looking at whether 3D printers could be used to create swabs that so early on in this process were so difficult to come by. And scientists at the lab tested these products on themselves when there was nobody else to do this, as we needed to evaluate these critical pieces of equipment as we scaled our response in the early days. Next slide. Partnerships, again, have been critical to our response to COVID-19 from the beginning. The Unified Command, which was a partnership between the Governor's Office, CDPHE, and the State Emergency Operations Center, worked very carefully with the lab staff, who again were sometimes testing this equipment on their own, on themselves, using the highest scientific standards to make sure that all of the tools that we were using in response to this pandemic were of the highest standard. And then working with the state EOC to ensure distribution of these supplies to all of our healthcare providers and to our local public health agencies. Next slide. Now, obviously, at the center of the COVID response, particularly at the peak of wave 1 and wave 3, were our hospitals and our long-term care facilities. This is where the greatest PPE shortages were coming. It was where the greatest need for testing was identified early on. We took a small state-run website known as EM Resource, which was used from time to time for disasters, and we turned it into a daily tool for reporting and for gathering information so that we had our finger on the pulse of exactly what was happening in our healthcare system. It allowed us to understand bed availability. It allowed us to understand how many COVID-19 patients were hospitalized in each facility. It also gave us critical information, blinking red lights is what we called them, on hospitals that were struggling with staffing, hospitals that were struggling with PPE, allowing us to move resources, at times allowing us to work with the Colorado Hospital Association and other hospital partners to actually transfer patients from one facility to another to ensure that we never breach the capacity of our healthcare system. Next slide. We have learned an enormous amount over the course of this pandemic, and we know that we always need to be prepared as a state to meet the needs of our healthcare providers and all Coloradans. And so the state Emergency Operations Center has worked diligently to set up long-term contracts with more traditional suppliers of healthcare resources, such as Honeywell and 3M. We have secured long-term leases on 2 large warehouses. We'll be rotating supplies through there so that we always have the supplies needed to support our healthcare system and all Coloradans as potentially cases of COVID-19 increase at this time and any future emergencies that we may face. The State Warehouse was a key partner and a key component of the school mask program. We have provided KN95 masks to all school staff between August and Thanksgiving break of last year in the initial support to ensure that our educators had all that they needed to provide in-person learning. We have distributed almost 1.5 million KN95 masks, over 4 million surgical masks, and over the totality of this program, we have received almost 30 million masks as we ramp up our supplies for the COVID-19 pandemic. And so what you'll see here is the significant amount of supply that we have on hand that will allow us to ensure that our healthcare providers, that our educators, that other frontline workers are protected as we continue to work through the next several weeks of this pandemic. And we are also prepared for any other future emergencies. I'll turn it back over to the governor.
Thank you, Scott Bookman. Testing has really been at the core of our COVID response from the very beginning. And we've rapidly scaled up our ability to do free, quick, easy COVID testing. In January, I announced the first of the nation effort to deliver COVID-19 tests to preschool through 12th grade teachers across the state, partnering with Binax. I even did some of those deliveries myself. FedEx did most of them, but I delivered them across Colorado Springs and Pueblo and the Denver area. Over the next few months, we're building that capacity even more for the essential workforce. And when the vaccine became available to restaurant workers, we helped provide them with an extra layer of protection by expanding eligibility to the Binax at-home testing program. It makes such a big difference to get that diagnosis early. Because again, especially somebody could be an asymptomatic spreader or mildly symptomatic, and to catch it before it turns into 5 cases or 10 cases is a really big deal, of course, for the people directly involved who won't get COVID, but also for the state as a whole. Binax at Home continues to be rolled out to preschool through 12th grade teachers and other student-facing staff, food service workers, early childhood educators, community college professors and staff. In fact, within the last month, hardworking Coloradans that have educate our students have gotten over 150,000 test kits. Today, I'm proud to announce that all public-facing workers can receive free Binax at Home testing kits. So whether you work in a retail store, wherever you work, if you encounter others at your place of work, you can get free testing from the state. Anyone who is required to interact with members of the public, could be hospitality and events, delivery and truck drivers, movie theater employees, gym staff, real estate agents, construction workers, maintenance, grocery workers, electric and utility workers, security workers. Signing up is very easy. All you need is your email address and where we send them. You can apply using a Google form and receive a confirmation email within 1 business day from CDPHE that includes the link to order the kit free of charge directly to your home. When you get your kit, there's instructions in there about how to log into the telehealth portal and get instructions from a trained representative in English or Spanish. It's very easy. It's a nasal swab. It's incredibly easy to use. There's 6 tests per box, and that is for a month. So that is every 5 days. You can get tested free, quick, and easy in the privacy of your own home. Results within 15 or 20 minutes. You don't have to wait days or even hours to get the test result. You will get them within minutes. And you can reorder them after 20 days for the following month. So I want to thank our testing distribution team at CDPHE. I want to thank Binax for making these rapid tests available. I'm really proud of this effort. This is a big deal in helping to build back the Colorado we love. There's you should have a logo you can scan on your screen that'll take you right to the sign-up form that will allow you to get these kits if you're a public-facing worker. As we rapidly scale up our vaccine capacity, this testing is even more important than ever. It's frequent. It's so free, quick, and easy, you no longer need to go anywhere. You can just do it in your own home every 5 days, and we encourage you to do that. Now to discuss this 4th wave that we're experiencing, which will look a little bit 4th and final wave that we're experiencing, knock on wood. It's a little bit different in other ways. We have more equipment, we're better ready. It's also affecting younger Coloradans because many of the folks over 60 and especially over 70 are fully immune at this point. With that, I'll turn it over to Dr. Rachel Herlihy.
Thank you, Governor. Good afternoon. So today I'd like to provide you with an update on the numbers, including our latest variant numbers, talk to you a little bit about the P1 variant that we first identified in Colorado earlier this week, talk a little bit about some of the details and things that we know, updated counts of that variant. I also want to share, as the governor mentioned, some age-specific trends that we are seeing as part of this 4th wave. As the governor mentioned, this 4th wave is going to look different, and I talk a little bit about how case distribution and hospitalization distribution is looking different by age groups. But first, I want to talk a little bit about our variant numbers. So as shown here, Colorado's had 1,472 cases of the B117 or UK variant, 24 cases of the B1351 or South African variant, 488 cases of the B1427429 California variant, and 12 cases of the P1 or Brazil variant of concern. You may recall that earlier this week, we announced that we had 2 cases, that was on Tuesday, 2 cases of that P1 variant. And the last couple of days, including as recently as just this morning, we've had additional cases of that P1 variant reported here in Colorado. I want to tell you a little bit about some of those cases. We do believe that there have been multiple introductions of P1 in the state of Colorado. We know that several of the individuals have a travel history, including one individual who did travel internationally. We know that's certainly a risk factor for introduction of some of these new variants in our state. We see that 2 household clusters are occurring, but there are additional cases outside of those 2 household clusters. These cases have all occurred in the metropolitan area, in Arapahoe, Boulder, Broomfield, and Denver counties. As far as what we know about this particular variant, There's still a lot for us to know. This is probably the variant where we have the least amount of information out there in the scientific literature. So a lot we need to learn. We know that this variant has some mutations that are in common with the B117 UK variant and some mutations in common with the South African or B1351 variant. And from what we do know, the concerns with it are increased transmissibility, possible increased severity, decreased effectiveness of some antibody treatments, risk of reinfection, and we've seen a concerning outbreak in Brazil in particular, where reinfection has been an issue. The information around vaccine effectiveness is less clear. As I mentioned, it does have a mutation in common with the B1351 South African variant, where we have seen a small decrease in vaccine effectiveness associated with that variant. But at this point, we really don't have definitive information about the P1 variant and vaccine effectiveness. But as a reminder, we know the impact to vaccine effectiveness, we believe, is small, and vaccines continue to be the most important way to prevent transmission of COVID-19, including these new variants. At this point in Colorado, you'll see here that we have about 43–45% of specimens that we are testing that are the B117 or UK variant, and then another 18–20% that are the California variant. So this means that really more than 50% of positive cases that are occurring in the state are now due to variants of COVID-19. And so because of that, if you develop COVID now, chances are that you're actually going to be infected with a variant that is probably more easily spread and could potentially cause more severe illness. Next slide. So this figure shows you our daily case counts in Colorado in those gray vertical bars, and then our 7-day moving average in that with that red line. And so you can see that we have very clearly experienced an increase in cases over the last couple of weeks in Colorado. This increase is similar to what many states around the country are experiencing right now, and it does appear that we have entered our 4th wave of illness, as the governor mentioned. Next slide. But this wave is looking a little bit different. We have variants that are making spread of the virus easier, potentially causing more severe cases in some instances. But we also have a segment of the population that is protected through vaccination. And we are starting to see that play out in our trends. This figure shows you case trends in those over 50, and that is shown in red, and those under 50, and that is shown in blue. You can see a growing gap here with consistently lower rates, really closer to a plateau in those over 50, where we have a more highly vaccinated population, but a much steeper increase in those under 50, where a smaller percentage of our population is vaccinated. You may recall that in previous press conferences, I've shown this data, first specifically looking at that gap that we were just starting to see in individuals who lived in long-term care facilities versus those that did not, and seeing the protection they were experiencing. I then showed you data looking at those over the age of 70, and this is really fantastic to see that we're now seeing this growing gap between those under 50 and those over 50 as we continue to see an increase in our vaccinated population sort of decreasing in age. So that's certainly the good news here. But the fact remains that, cases are continuing to go up, and until we get to a point where we can, achieve this plateau or a decline in cases like we're seeing in those over the age of 50, we really need to continue to use the strategies we've been using. So that means wearing masks, social distancing, hand washing, staying home when sick or after an exposure, getting tested, and of course getting vaccinated as soon as you can. Next slide. This next figure shows you our hospitalization trends. Our hospitalization rate is lower than it would be without high vaccination rates in our older population that's most vulnerable to severe illness and hospitalization. But unfortunately, we are also seeing an increase here, especially in the last week. Next slide. But just as the 4th wave looks different with regard to our case trends, age groups of hospitalizations are also looking different. This is a figure from the New York Times from earlier this week, and I really liked how they showed this data on trends in hospitalizations and age groups. So on the left, they're showing you national hospitalization data over time. On the right, they're showing you whether certain age groups are more or less likely to be hospitalized now compared to earlier in the year. So risk of hospitalization is increasing the most in those under age 50, and the risk is flat or decreasing in those older than age 60. Next slide. So we reproduced this analysis here in Colorado with our data, and in Colorado, the risk of hospitalization is clearly increasing in those less than 50, but is flat or decreasing in older age groups. And this is an important reminder that severe infections can and are occurring in younger populations. It's another reason why younger people need to be vaccinated as well. And until we can get these decreasing or flat trends for all age groups in the state, we really need people to keep wearing masks and keep social distancing, and of course, get a vaccine as soon as one is available to you. Thank you.
Thank you, Dr. Herlihy. So as you can see, the fourth wave will look different, mainly due to variants of concern that'll have a larger impact on Coloradans under 50. So if you haven't been vaccinated, get vaccinated, but until you're fully vaccinated, which is 15 days after the second dose of Moderna and Pfizer, 15 days after the first dose of Johnson & Johnson, please avoid social gatherings, wear a mask. The virus is becoming more prevalent across the entire United States, including in Colorado right now in this fourth and final wave. It also is exciting to see the progress we made in vaccinating Coloradans age 60 and up, and especially 70 and up, and the difference that is making in just reducing hospitalizations by so much. We are seeing, of course, a sharp rise in hospitalizations of people 18 to 50, which is why we need to be careful. We're able to ramp up our vaccination efforts to get more vaccines into arms, especially people now under 50. By the end of May, everybody who wants it will be able to get it, probably even sooner. There's 3 safe and highly effective COVID vaccines available to Coloradans. And right now, we understand that it can be frustrating that demand still exceeds supply, but that won't be the case for too much longer. Getting 400,000 to 500,000 vaccines a week into Colorado, getting every one of them into arms. We're only a few weeks away from having more proactive outreach as we move to a situation where the supply exceeds the immediate demand, and we have to work to make it more convenient to a larger number of people. So please, get the vaccine as soon as you can. If you're a younger Coloradan who thinks you're not at risk because of your age, I encourage you to think again, get vaccinated, be careful. This virus, of course, is not as deadly for younger, healthier people, but nevertheless, this increase in our hospitals is almost all younger people because there's a decrease of older people, and they're not all going to make it. I can tell you that. Most of them will when they're hospitalized, but not everybody's going to make it. And most importantly, we don't need to ride a fourth wave of this virus. We can end it by just living like we did in February, where we got it under control in early March. We just need to go back to how we were in February and March for another few weeks. And then we'll have a more or less normal summer after we've reached that herd immunity level and 70, 80+% of the population has been vaccinated. Thank you, Dr. Herlihy. We know from research and data that the majority of Coloradans are ready to get the vaccine. But we need to do everything we can to break down any barriers to getting information, including for historically medically underserved communities. That's why CDPHE launched the Power the Comeback, or Crea el Futuro in Espanol, a new vaccine information and outreach campaign which will be going live as soon as next week. This vaccine is one of the most effective and safe vaccines that we've ever had in record time. And just getting that word out to people, that people 16 and older anywhere in Colorado are eligible to get vaccinated. This is a result of community input and participation, really with Coloradans from diverse backgrounds sharing why they decided to get the vaccine, and importantly, how to make plans in content that will be available on multiple platforms to reach Coloradans where they are. Spots like the one you're about to see can be viewed everywhere you get media. That's part of the new media buying. It'll be online, radio, TV, social networking, probably things that you've never heard of and I've never heard of. Wherever people are getting their media, they're going to see this. Let's go ahead and play the video.
Gina's been keeping the line going all throughout the pandemic, and she just got her COVID-19 vaccine. She learned that over 170 teams of experts across the globe work countless hours to develop an effective vaccine, and trusts it's safe, because millions just like her got it. Her family depends on her, and they know she's now well protected against COVID. People like Gina are powering the comeback. You can power the comeback too. Find a vaccine near you.
So to keep Coloradans informed, we've developed a texting platform. People can opt in to get COVID vaccine information by texting the word vaccine, if you want it in English, or vacuna in Espanol, to 1-855-355-4566. So just text the word vaccine to 1-855-355-4566. This is our shot, Colorado. When we strengthen our protection against COVID-19, we get back to doing the things we love, and you have one less thing to worry about in your own life. We stand ready to get you the very best information to make an informed decision, so you can feel confident about getting both of your doses of Pfizer and Moderna, or one dose for Johnson & Johnson, and you can help empower others to do the same. Empowering local control has long been at the core of our strategy for keeping communities safe through the pandemic. We've learned from local innovations like Mesa County's 5-star system that they didn't need to even close their restaurants, and we learned to be able to implement that in other areas across the state. Well, of course, there's been public health orders in place. Colorado has essentially been open since last April for a year, and we've utilized the dial system to inform individuals of your risks so you can make the right decisions to protect your health, and we can make room for economic activity and earning a living. On April 16th, the dial system will evolve from a statewide public health order to locally managed and local ordinances. Local governments will be able to make the best decisions based on their community's needs and balancing those needs through the dial and better adapt their resources. I want to emphasize, of course, that I strongly support regional coordination in counties with local public health authorities and communities, especially across popular commuting routes in areas where people live in one area and work in another. And our team will continue working closely with local entities to provide them the very best information to develop plans that help communities tailor their response to the local need. Because until more Coloradans can get the vaccine, we need to continue doing our part by staying apart, keeping ourselves safe by wearing masks around others, staying 6 feet apart, and when you choose to gather with others or have a family outing, do it outside, small group. You know what works best to prevent this kind of spike. You've already done it. We've saved our healthcare system from being overwhelmed. We have prevented a greater uptick in cases. We've limited our losses here in Colorado. But now everyone, especially those who aren't vaccinated, should continue to take these precautions for a few more weeks or months until you are fully vaccinated. So let's stay the course. We have every tool at our disposal, and all it requires is the will to flatten the curve so we can end this fourth wave and final wave and get back to our lives as normal. With that, I'll be happy to take some questions.
Oh, sorry. So Governor, you're talking about changing the dial. Do you anticipate the local communities will be able to respond in a way if this fourth wave is big, in a way that they'll be able to to suppress the pandemic, or how worried are you about controlling it without having it be at the state level?
Well, last week I extended the mask order for another 30 days into early May. And of course, the important thing is that the majority of Coloradans are wearing their masks around others. And throughout this pandemic, we've always worked to have a COVID response that has a values local control that's really tailored to the diverse communities across our state, because we know that each community has been affected differently. And we know that the ability to support yourself and pay rent and remain housed is a legitimate public health issue, just as the measures to avoid contracting COVID is a legitimate public health issue. And of course, we're close to the finish line. We're not yet there. We need folks to do their part to wear masks and avoid social gatherings, no matter where they live. But how that translates into local requirements is really a matter that is best conducted by the local authority in that area. I have full faith in our city councils, our mayors, our county commissioners, our local public health authorities to know the best way to message the importance of mask wearing and avoiding social gatherings while we continue to achieve the level of vaccinations we need to finally end this terrible pandemic.
Hi, Governor. This is Karina Jewelry from the Aurora Sentinel. Is the state monitoring whether any people have contracted COVID after being fully vaccinated? And if that is being tracked, how many instances have occurred in Colorado?
We are tracking that, and I believe Dr. Herlihy will have a presentation on that next week. It's going very well. The numbers, obviously, there's going to be a few hundred that did, but if among a similar group of people who didn't have the vaccine, it would be thousands or tens of thousands. So we'll have that all next week in a presentation for you. There's been a lot of interest on that, and we're still gathering the data, but we do track that.
Governor, there's several counties that are sliding back, I think, to yellow and to orange. I think Summit County is one of them, and Jefferson County is another one. Next week, you're planning on getting rid of the dial and letting counties decide for themselves how to proceed. Are you still planning to move forward with that, given the fact that there's these rising hospitalizations, the rising case numbers, and some of these counties that are backsliding?
First of all, the dial does remain. It simply becomes advisory, and counties can tweak it to fit their own unique situation. I think that I'm very confident that having nothing to do with the dial, the end of the ski season will lead to significant decreases across high country in Colorado. So what you see in Pitkin and Summit and Route and some of those areas, they are now in mud season. The tourists have left. Those numbers will naturally come down. Many stores are closed until their summer season, and we have several weeks of relative quiet across the high country where we fully expect those rates to come down. Where the greater concern are the population centers in the Denver metro area, the Colorado Springs metro area. This is where we really look forward to working with our local partners and our mayors and our local public health authorities and our commissioners to make sure that we tailor the right messaging to have the best possible public health impact. And certainly across the board, that includes wearing masks when you're around others, avoiding social gatherings, and of course continuing to work with our local partners to advocate to make sure that people get vaccinated safely. Do you have a follow-up question?
Hello, Governor. Jesús Carrasquel from Noticias Univision. I have two questions. La primera es, Gobernador, hemos recibido varias denuncias de personas a quienes le han negado la vacuna por no ser ciudadanos americanos. ¿Qué medidas puede tomar en frente a esto? Y la segunda es, ¿hasta cuándo tienen protección las personas que no pueden pagar la renta para que no sean desalojadas de sus casas?
Quiero tener muy claro que nadie en nuestro estado necesita ser ciudadano o tener identificación para vacunarse. Punto. Si algún proveedor le está pidiendo ser ciudadano, por favor, repórtelo en la página ciovaxconcerns.com, porque sus acciones son contra la ley. Por el segundo pregunta, las personas en Colorado no pueden ser evacuadas de su casa por no pagar hasta que el moratorio termine en junio. Si tienes preguntas, pueden llamar al 1-844-926-6632 o en el sitio de red coloradohousingconnects.org. Jesse, did you have a follow-up?
Think about imposing any kind of base restrictions. I know there were specific ones for indoor events, but things like restaurant limitations. If the dial goes away, then there's really nothing.
Yeah, the state is going to, as many states are that are going. The state will be involved with large indoor events. So by involved, it doesn't mean that they won't be happening. For instance, think about the Nuggets; they're happening, but it means that they will remain under state supervision. Under a waiver process driven by locals, but the state will continue to take a look at large indoor events with lots of people.
Hi, Governor. Seth with the Gazette. Two questions, one for you, one for some of the health folks. Is it too soon to be taking the steps that we're taking? Obviously, the threat to the hospital system seems significantly diminished, but Coloradans are still getting sick at higher rates than for several weeks. The variants pose serious problems. Positivity rate is up. I mean, has any of that given you any pause? And second question would be, Dr. France sort of alluded to, anxiety, not drinking water, not having snacks as contributing to some of these side effects from Johnson & Johnson. Is that what happened here? Just to be clear, were some of these people kind of lacking in some of those things? Thank you.
We'll go to Dr. France in a moment. Let me take the first one. This wave is different than other waves. We have our most vulnerable Coloradans successfully protected. That means that the ratio of deaths to the incidence of the disease will be lower. It does not mean that we're not going to lose more Coloradans. And that's what the emphasis of our message today is, that if you are 18 to 50 and you're not vaccinated, continue to take these precautions. Because yes, if you're hospitalized, you might only be hospitalized for 2 or 3 days instead of 8 or 9. But in every age group, there are people that for mysterious reasons have a severely adverse reaction to this virus. For some, it's fatal. For others, the recovery is a very long haul with symptoms for months, and we don't even know whether they'll ever fully recover because it hasn't been long enough for them to do so. And that's the reason that it's important, if you haven't been vaccinated, to wear your mask and avoid social gatherings. If you need to see others, do so outdoors at a space of 6 feet, which is relatively safe, until you have the opportunity to get vaccinated. And please get vaccinated in the next few weeks so that you have one less thing to worry about, so that you will be there for your friends and family and loved ones, and so that our state will finally end this pandemic. Dr. France?
Thank you for the question. Yes, when I reviewed the 11 cases that happened 2 days ago, I was struck by how all of them seemed to be associated with being dizzy, lightheaded, fainting, potential feeling nauseated. And then yesterday, when there were cases reported out of North Carolina, 18 at a large community vaccine site, they too had that same characteristic. So when you look at all these cases, they really are classic for the person who is anxious when they arrive at the doctor's office. They're getting a blood draw, they see blood, they're getting a vaccine, and with those anxieties come the potential for one of these reactions where people get dizzy and faint. And we've known for some time that there are things you can do to prevent that from happening in the first place. Being sure you've had some good liquid in, a drink of sorts before the hour that you've come in, maybe eat some salty foods like potato chips. There are techniques that people can use when they feel faint. People who know that they faint at the sight of needles can learn about these techniques online that you can use that help get that blood pressure up and move the blood back to your head. So I do think that the cases we had in Colorado, on my review, all felt like they were of the same criteria and were caused by this anxiety around needles, the tension of getting a vaccine, the relief of the vaccine, and lightheadedness followed.
Hello, this is Wicketer from the Denver Post. I have a question, Dr. Hurley. With the increase in patients, mostly being among young people, is that just a reflection of they're the ones who aren't vaccinated, so you're going to see more of them, or patients?
I think she just asked, about younger people, and is that a result of them not being vaccinated that it's spreading there?
Thanks for the question. It was a little difficult to hear you, Meg, but I think I got the gist of it. So, yeah, I mean, I think we are seeing the cases occurring primarily in the population that hasn't been vaccinated yet. And here in Colorado, like most places around the country right now, that tends to be our younger population. So we're seeing, lower rates of infection occurring. First we started seeing those lower rates of infections in our population that lived in long-term care facilities or among our long-term care, our healthcare workers. And slowly it's gotten to lower and lower age groups. And obviously we hope in time to have all age groups included there where we start to see these lower rates of infection. But for now, the reason that we believe they're seeing lower rates in those over the age of 50 is that that's where we see a higher percentage of our population vaccinated right now.
Yes, hi, Governor John Frank here. I'm wondering, are you concerned that more people will die without state standards?
Well, we've lost close to 7,000 people, and sadly, we will lose more Coloradans to this deadly virus. To minimize the loss, what's important is no matter where you live, especially if you haven't yet been fully vaccinated, wear a mask and avoid social gatherings. And if you are exhibiting any type of cold or flu-like symptoms, self-isolate and get tested. We've made testing even easier. If you're in a public-facing job, you can request it in your own home. You don't even need to get anywhere. It'll be sent right to you. And we encourage you to sign up by scanning the barcode that we provided earlier, and we'll also make that available on the internet. We have full confidence that our local public health agencies, our cities and counties, will continue to be the most effective messengers as the level of government closest to the people, in the best way to message the importance of wearing masks and avoiding social gatherings in the fourth and final wave of this deadly pandemic.
Hi, good afternoon, Governor. This is Sergio Ornelas from Telemundo Denver. My question is in English, but feel free to answer in Spanish if you can. As more people get vaccinated, where does the state stand on businesses requiring customers to show proof of vaccination against COVID-19, such as restaurants and bars?
Is your media in English or Spanish? Which would you prefer? Oh, es Telemundo.
Spanish,
okay,
please.
es Telemundo, sí.
Telemundo, por favor, gracias.
Los negocios tienen la opción de proteger sus empleados y sus clientes si quieren, para tener una prueba. Por ejemplo, algunos negocios usan una temperatura termómetro antes de entrar, y también, por ejemplo, algunas aerolíneas necesitan una prueba o una certificación de vacunación. Este es una decisión privada, y la mayoría de negocios quieren dar conferencia en sus clientes y empleados, y tienen algunos días para hacerlo.
I was trying to ask was, are the variants a factor in hospitalizing more younger people?
Yeah, I'll let Dr. I would just add that the variants generally spread faster when more people have them, even if the percentage risk of hospitalization is static. The fact that more people have it lead to a greater number of hospitalizations. It is possible that some of them are more severe. I don't think that's been demonstrated yet. I'll turn over to Dr. Herlihy.
Yeah, so the data is clear on increased transmissibility associated with the variants than it is around increased severity. There is some data, especially with the UK variant, about increased severity. But, you know, I think the reality is we do think that variants are contributing to increased transmission in the state right now, probably also contributing to increased hospitalization in the state, simply because that is most of our cases right now. As I said, more than 50% of our cases in Colorado right now are being caused by variants of concern. So that is absolutely contributing to the caseload we're seeing.
This is also why the United States of America, the wealthiest nation on earth, should take an active interest in helping to vaccinate the rest of the world, including the developing world. Because the higher the incidence of the virus anywhere, the higher the incidence of new variants anywhere, and the higher the incidence of new variants, the likelier it is that variants will arise that our vaccines are less effective against. So it is very much in the interest of protecting the public health of Coloradans and Americans that the United States of America take a leadership role in helping to provide enough vaccines to end this pandemic, not just here, but across the world.
Governor, with states, the way I understand it, 5 states are responsible for most of the cases in the U.S. right now. Those include Michigan, Florida, places like that. Have you had any conversations with federal authorities about diverting any vaccine to those 5 states to help with that 4th wave that they've got there? And how confident are you that vaccine supply will hold up?
The federal government has approached vaccine distribution in a fair way and has been conducting vaccine distribution pro rata across the states. There's a few caveats to that. There's been, for instance, additional doses at federal and military installations in Colorado and in other states. I think that that's the best way to manage this, in part because when you're at the high point of a peak, it's too late for vaccinations, which have a delayed impact, to affect that peak. They might prevent the next peak. But Colorado remains among the leading states in getting the vaccine into arms. We look forward to increases in supply from the federal government. We are doing 400,000 to 500,000 vaccines every week. Frankly, I think we have confidence in our system where we could be doing 700,000 or 800,000 a week if we had that many vaccines. That's it. Thank you all.